I hope you enjoyed watching the first episode of our interview with Dr. Martin Vestuba. In the second episode, we will let you know how you can get pregnant even if you have no sperm or severe sperm abnormalities. The good news is you always have hope. Let's hear what Dr. Vestuba has to say. I have a specific questions from some patients. What if their semen analysis indicates zero normal morphology? Will this male patient still be able to have a child?
So that's a question that I deal with routinely. And what I try to bring things into focus for what men can relate to. And the way I would describe that is when we talk about the shape of the sperm morphology, it's like the shape of an airplane. Is it aerodynamic? Is it a jet fighter or is it a clunker? And this just tells about the outside packaging of the DNA. The sperm itself is just a delivery system for the DNA. The DNA in an abnormal shaped sperm can be just as healthy as a normally shaped sperm. It's just how fast it might be able to get there. The more sleekly shaped sperm are more likely to get to the egg and do good things with the egg under normal intercourse, but with IVF, we have control of that. Generally, we'll pick out the pretty shaped sperm, but it doesn't mean that the DNA is abnormal just because the outside shape of the sperm is abnormal. Also, there is a technology now using microfluidics therapy. A particular company by the name of Zymote is the first, at least in the US. And with that type of technology, even someone with 0% normal morphology, there is already data to suggest, and we are starting a study on this, that we can take that 0% normal morphology, run it through a microfluidics device, and find many normally shaped sperm, such that could be used with in vitro fertilization.
That's really good news.
So, but even if you don't have perfectly shaped sperm, that does not mean that it can't be a perfectly healthy child, and that's very important.
For patients with severe sperm abnormalities, what kind of hormone testing, genetic testing, image testing, or special sperm testing, you kind of mentioned in your previous questions answer, do you recommend to them doing prior to their treatment?
If there is no sperm in the ejaculate, that could either be from obstruction, or it could be that they're making little or no sperm. So if we're concerned about obstruction or some of their anatomy is missing, cystic fibrosis genetic testing is recommended. Also, if they have a low volume ejaculate, low pH ejaculate. So an ejaculation is the first thing I'm going to want to know, and that will help guide what genetic testing I would get. The two other genetic tests that are routinely performed would be karyotype, which is sort of the big picture of the sperm, of the DNA. All the chromosomes are laid out. They kind of look like socks laid out drying. And the last ones on the lower right would be the X and Y if it's a male, or XX if it's a female. This gives the big genetic story, and we're looking to see if there's any major things missing. But then there is another study for men called Y chromosome microdeletion. Now, females like yourself are XX, males are XY. And in that Y chromosome, there are areas that can define whether sperm is being made or not. So if somebody doesn't have any sperm in their ejaculate, we always like to see the karyotype and the Y chromosome microdeletion, or the YCMD test, to see if there is any genetic evidence. Because some men, frankly, if they have certain findings, they do not make sperm, they will never make sperm, and it's nice to be able to tell them that early on before we do a lot of invasion into their body, that sort of thing.
Great to know. And next question I get a lot from our patients. Even some people who work in the fertility field, they get confused. So what is the difference between TESE and the TESA, these two things?
Sure. So these are both techniques that would be used for sperm retrieval. Not always in a man who has had a vasectomy. It could be various other indications, but most typically it would be obstructive azoospermia. This is a man who has good sperm production, but who has a blockage, typically a vasectomy. And so to do a sperm retrieval for them, the technique, since ICSI really, which was about 30 years ago, 1993 was when ICSI, intracytoplasmic sperm injection, with that you can use very, very low numbers of sperm. So once we could do that, then we started going into the testicle itself to retrieve sperm. Before that it was from the epididymis. From the testicle, TESE stands for testicular sperm extraction. This, after numbing up the patient, this is where a small opening is made in the scrotum, go directly down to the testicle. We can typically do this right in the office where the man has been numbed up. And we can remove a very small little cube of tissue, smaller than a sugar cube, much smaller. And from that we can extract sperm out of it, typically for anywhere from 3 to 6 or even more cycles of IVF with one procedure. That sperm is typically healthy, very useful for us. But over the years, just the idea of somebody making an opening into the scrotum, into the testicle, men didn't like that so much.
Yeah.
I developed my own particular technique for TESA, testicular sperm aspiration. This is utilizing a needle. And if I had known you were going to ask me that question, I should have had a needle here. But we can, after numbing up the male,
Yes.
we can pass a tiny little needle through the skin and then put negative pressure, suction pressure, and actually draw out some of the tissue from inside the testicle with no cutting. And so we can draw out that tissue, and my personal studies have shown that 95% of the time we can get just as good a specimen as we could with the open procedure, and such that it's good for 3 to 6 cycles of IVF, freezing and all of that without any cutting. And so this is a technique that we would use for obstructive azospermia, the needle technique.
And azospermia is basically absolute no sperm, correct?
That is no sperm.
Okay.
Now, this is a little bit off what you just asked, but if a patient has exceedingly low numbers of sperm, or maybe just a half dozen sperm in their ejaculate, or 0 sperm, we can further work them up by using tiny needle to go through the skin in a procedure called testicular fine needle aspiration mapping. And I would reach out to all men that never take no for an answer. If in your country, your community, you have been told you have no sperm, give up, I would say go a little bit further, because we have found sperm, countless men who were told that they had no chance. We found sperm on them, and we were able to bring about pregnancies utilizing that sperm. The mapping procedure allows us, with a 9 out of 10 chance, if there is even any sperm there, that we'll be able to find it just by putting a little needle through. It's different than the TESA procedure, but it's similar, no cutting, and we can get an idea of what's going on inside the testicle. If there is extremely low amount of sperm being produced, we can then, in a more intense procedure, take a person to the operating room and open up the testicle, and even if there is only a handful of sperm, find those sperm and use it with IVF.
And these procedures can be done only to one side of the testicle, or can be done to both sides of the testicles?
Generally spotty in both testicles if there's any in one. So it's not unusual for us to do a procedure on one testicle and then do a procedure on another testicle later.
Okay. How fast is the recovery? And they usually went through the procedure under IV sedation, or what type of sedation?
So when we are doing procedures in the office, which would be like the TESE sperm retrieval or the TESA sperm retrieval, sperm retrievals, typically we'll do them in the office under just a local block. We also offer laughing gas, nitrous oxide, which is very pleasant and takes away the anxiety for men. Or we can use oral sedatives. So the men are usually quite fine with these procedures. More significant procedures like the ones where I'm opening up the testicle, that is called microdissection, testicular sperm extraction. That is done in an operating room with the male asleep. That one, again, it's a little bit more intense and requires an anesthetic. But the great majority of procedures we do right in the office.
So after a man had one of these procedures you mentioned, will that impact their sexual function afterwards?
The thing about sperm function and fertility function is it really has nothing to do with erectile function. And so the short answer is no, it won't impact that.
I think
however, infertility, again, as we discussed earlier, it impacts the relationship so deeply that sometimes there are other things that are overlaying the relationship that we need to address.
Yeah, thank you so much. Yeah, we learned a lot from you today. Is there anything else that you would add on and share with our audience who's watching this video today?
I would say that there is almost always hope. If you've been told there is no hope in the past, I would leave no stone unturned. Talking to someone like Gen 5, Dr. Wood, like myself, in terms of the female and male fertility aspects, I think are very wise to just be as certain as you can be before you give up, and maybe at least a second opinion would be wise for couples.
So don't lose hope. That's the final message we get. Thank you very much, Dr. Bastuba, for your time.
Thank you.
Thank you. I hope today's interview with Dr. Martin Bastuba answered a lot of your questions. Whether you were told to have no sperm, highly abnormal sperm, or you had vasectomy procedure done in the past, there's almost always a way to help you get pregnant. If you like our video, please give it a thumb up and subscribe to our Gen 5 Fertility's YouTube channel. Thank you for watching.